I'm Alice Park, and I'm joined by Bonnie Castillo, a registered nurse, executive director of National Nurses United, and a 2020 Time 100 honoree. Bonnie, congratulations on your inclusion on the list, and welcome to Time 100 Talks.
Thank you. Thank you so much. We really, really appreciate this, and I certainly appreciate it, but really our whole union appreciates this.
Well, I wanted to talk to you about really the year that we've had. It's certainly been a challenging year for all of us, but I think it's fair to say that it's been especially hard for frontline healthcare workers. From a nurse's perspective, how prepared were we for this pandemic, or how unprepared were we for the pandemic?
Well, that's for us the most heart-wrenching part of this experience, is that we were and still are so woefully unprepared for confronting COVID-19. And for us as registered nurses, it's very frustrating because we know what we need. And so while we say that the virus is novel, the science of infectious control and protection isn't. And so we know that we could have done better, and we need to still do better.
And what are some of the ways that we can improve and learn from this experience so that we are better prepared the next time? And we know there, as we hear from public health experts, that there will be another outbreak. There will be a next time.
Yes, and we're still in the middle of this outbreak. What we know is that we need a national, coordinated, robust infectious disease response. And we haven't had any of that. And instead, what we've had is a very discoordinate and response, and a real lack of leadership at the federal, state, and local levels. And so what has happened is that we haven't been able to protect our frontline workers, nurses, healthcare workers, and in turn, then our patients. And so as registered nurses, we know what we need to do, and we need to fully enact the Defense Production Act and actually manufacture the PPE and the protections that we so desperately need on the front line. If nurses aren't protected, then we're not able to protect our patients and in turn, the public. So what we are forced to do is essentially improvise, and in many cases, nurses are actually having to bring their own PPE to work to this day.
I think that, as you said, has been one of the heart-wrenching things that we've learned from this pandemic, is that we assume that resources are there, that, for a healthcare worker like a nurse, that everything they need, they've got, especially in the United States. Can you tell us if there were states or programs that you see as models that got it right in terms of being prepared and were able to implement emergency plans? Did you see examples of that? Are you hearing from your nurses about things that went right?
Unfortunately, we are still living through this pandemic and trying to save as many lives as possible. And where we've had success is where we've been able to be vocal and use our collective voice and speak out against these dangerous practices. For instance, making nurses and other frontline workers using surgical masks instead of higher levels of respirators. And we know that obviously then we ourselves become vectors of infection instead of being able to keep our patients safe. So in terms of where we've seen examples of good examples, in other countries, we have been in communication with our nurse colleagues, for instance, in South Korea and Canada, where, they experienced some of these shortages initially, but then for instance, in the case of South Korea, they started manufacturing PPE, the personal protective equipment there, and then we're able to adequately protect their workforce. We need to do that here in the United States too, but we need leadership. We actually need national leadership. Instead, what we have is, actually we have doubters and deniers of science, and that has actually we've seen this happen with federal agencies. And so instead, the bottom line is dictating the CDC guidelines. What we're seeing is in this in our healthcare industry, which is a profit-driven industry that is based on the bottom line instead of care and need. And so we need to shift that. We need to shift that to ensure that our frontline workers, our nurses, and other healthcare workers get the protections they need so that we can in turn protect our patients and then ultimately confront COVID-19.
We saw early on in the pandemic, you mentioned the issues with shortages of PPE for nurses. We saw early on that nurses were very vocal and really stood up for saying, we shouldn't be reusing masks. We shouldn't, have to kind of reuse the PPE as well, and raise questions about the safety of that, which turned out to be justified. How much change has that sort of vocalization of their concerns, how much change did that enact, and do you feel that that's pushing us toward the right direction?
Well, for us, it's been a matter of life and death. And the National Nurses United, we have lost 11 members. And if we had not been out there collectively advocating and fighting tooth and nail for every single N95 and every single protection, we would have lost many more. Unfortunately, as a nation, we have lost over 200 nurses to COVID-19. And, obviously we're, in terms of deaths from COVID-19 we're close to 200,000 deaths. That's completely unacceptable. It didn't have to be that way. So our collective voice, being out there in front of our hospitals, and advocating for to ensure that we get the equipment we need and that the patients in turn would be safe, is what has enabled us to force this healthcare industry to give us the protection. So every single mask that we have been able to get is only because we've been able to be out there collectively. And we know that we wouldn't be able to do that if we didn't have a strong national union, of which we have.
As we heard from some of the nurses just earlier who responded to the pandemic, they said, we don't think, we just do. I'm meant to be here. That dedication really comes with a price, though. And what have you heard from nurses about the price of that commitment?
Right. Well, and I, completely agree with that. Because we have been expertly trained to do this work, and we are a science-based profession. So we know what to do, and we always know to err on the side of caution and use the higher levels of protection. It's not a question for us in terms of whether we go in or don't go in. We often say that when disaster strikes, nurses run into the disaster. They don't go the other way. And we're trained to do that. We are compelled to do that. We have a mission to do this. But we also need to be respected in terms of our professional judgment. We know what we need to do it safely. And doing it safely means having the higher levels of protection, of which we know that we can achieve, right? But because we know that in other countries they've achieved this. Unfortunately, we have met resistance in our workplaces, with our employers, and at the federal, state, and local levels in terms of government. And the lowering of guidelines has left us even more vulnerable. So when I say lowering of guidelines, I mean the CDC, other state agencies, and they're lowering the guidelines according to what the healthcare industry is saying they can or can't do.
And one of the issues that nurses have raised is the one of how infectious they're exposed to an infectious disease,
Yeah.
and the question of how infectious they might be to their own families. Um, One thing I'd like to ask you is that in terms of preparedness, we don't seem to have a system where when nurses, as you said, were running into the pandemic, there was nothing really to say, once you've been at work, when you come home, you should be isolating, or here's where you can go to isolate if you're concerned about, having been exposed. Has there been any movement toward addressing that issue for nurses and healthcare workers?
Through our collective action. And when I say collective action, I mean, one of the, we had our neighbors, we had our fellow union sisters and brothers bring us their masks, whatever that they could, muster up, and because they knew that we were going in there. Of course, we were going to go in there. We are there for those patients, and it's very difficult because at a time when we're putting it all on the line and we're willing to do this, we are, deathly afraid of infecting our family, our children. I mean, the stories of nurses not being able to hug their children or their partners, their spouses, and they stopped doing this months ago, having to self-isolate and figuring out ways to self-isolate, going through the ritual every shift. Our nurses haven't been able to shelter, not one day. They have been going in, and they continue to go in. But they also knew that we don't stand a chance of confronting COVID-19 unless we do better. And that means getting the proper protections, the proper staffing, and we're not going to stop advocating. We're not going to keep our mouth, we're not going to remain silent. Well, we know we can do better, and it's simply a matter of leadership at, as I said, at all levels, federal, state, and local levels. And it is a matter of ensuring that healthcare is a human right, that that we have a healthcare system that is based on care and not profit.
Why do you think it's so hard in this country for people to accept or act on the idea that healthcare is a human right?
Mm-hmm. Well, unfortunately, we have a huge industry that has, been operating and profiting upon people's illnesses and death, ultimately. So as registered nurses, union nurses, we are used to fighting in our hospitals for protections, and we do that. And we do that, well. But during a pandemic where you have so much more death and it is so infectious, this model is a failure. You actually have to have a model of care, and it has to be a national model of care where the priority is on patient care in need and finding that cure for the novel virus, and not on making more and more money. So that, that's a fun, I mean, we fight these kinds of fights pre-COVID. We've been in, we've always had to advocate for safer staffing and, health and safety regulations and standards. And I think that we've done a very good job of that. But when we were hit with the pandemic, and we knew that the model was one of looking at the bottom line. We knew that they weren't stocked. The healthcare industry subscribes to what's called just-in-time stocking practices. So we knew that the stock was probably insufficient. They locked it up, literally locked it up. So we had nurses going in and there were respirators there, and they were locked up, and they wouldn't give it to them. And nothing happened to them. In our mind, that's criminal, right? When you know that you're confronting a deadly virus and that you potentially could give to so many other people, and so many more people are going to die. And you have someone, right, where we had instances of where this PPE was locked up. That's what we were dealing with, which is why nurses were forced to go into their basements and their garages, and why their neighbors brought them any kind of an N95. It wasn't even hospital grade N95. It was our garden variety N95. But it was better than nothing. But the fact that they had to do this is just criminal. They should not, and they are still having to do this. So, which is why we do not have this under control. And we are looking at second and third waves. We're looking at months, we're looking at years. And this for us, that's why we are out there in front of our hospitals. We're not going to just stay silent. We're going to take care of our patients. We're taking care of our patients, but we are going to be advocating forcefully. We're not going to just stay in the hospital walls. We will be in the state legislatures. We will be in the Capitol. We are going to be voting. We are actually our leadership. We have made an endorsement of Joe Biden and Kamala Harris. We know that we have to start there, and we aren't going to just stop there. We know that we have failed so badly at this point that it is going to take some time to reel this back. We are doing what we can do every single day, and we know we're saving lives, but the lives that we've been able to save is a result of us speaking out and advocating for more protections. And if we hadn't done it, if we hadn't been out there, we know that we would have lost more of our own, but we would have lost so many more patients. It makes us sick that so many people have died, and so many more people will die until we start following the science. We know what to do. This is not an unknown. We actually know how to confront COVID-19 and other infectious diseases, but we actually need fundamental change in our healthcare system. And as I said before, this is about having a system of care based on healthcare as a human right.
Are there specific policies or laws that you mentioned that your organization is looking at amending or reforming that led to the fact that some of that PPE was locked up and remains locked up today, and that it's still happening today? Are there any specific policies and regulations that your group would like to address?
Well, certainly we, are in support of the HEROES Act. To date, every congressional measure has failed to address protecting the frontline workers, and that's completely unacceptable. So we are in support, obviously, of the HEROES Act, but more importantly, and we have been fighting for this for decades, Medicare for all. If we actually had a healthcare system that was based on human need and care instead of profit, we would have done so much better. And you can look at other countries that actually had a system of care. Their rates of infection and death are so much lower, and their leadership made remarkably better decisions. We need to have a safety net. And that safety net is healthcare security for all of us, for every single person here. This is fundamental. This is a fundamental tenet that we believe in, and we know, it is at this point, we have seen this system function under a pandemic, and it has been an utter failure.
And on top of everything that you mentioned as far as the resources and the policies, given the infectious nature of COVID-19, nurses really, had an additional burden in which hospitals changed their policies so that families and relatives could no longer visit patients. And nurses really bore the brunt of the additional kind of emotional support.
Yes.
How has this
Well,
impacted them, both as
yeah.
professionals and as people really facing these difficult situations every day?
Well, we have seen so much more death uh, and than in our entire careers. This is an unprecedented moment for every single registered nurse in this country. And we have acted as our patients' only guide out of this world. This has been a very hard time. While nurses deal with death and dying all the time in terms of their career, this has been unprecedented in terms of the numbers of death and acting as the only sort of guide or last person with our patients when they pass. And it's been very emotional for them, but it's also a sacred time that we believe we have to be there for them. We do not want one patient to die alone, and we want to honor their being, and we don't want them we don't want them to suffer. We don't want them to be alone at that moment when we see so much fear in their eyes. And we know that we've seen some very difficult deaths here, but it is one of the things we do. It is one of the things that we hold sacred, that we will continue to do. But it has taken an emotional toll on nurses because they know that they or their family and loved ones could also be in that position, which is why they will not let their patients die alone.
And has your organization discussed and implemented support systems for your nurses? Because as you said, this is both a physically and emotionally difficult time for them.
Yeah. Well, we have been advocating, for full health care, including mental health care, for everyone in this country. And yes, we are, as union nurses, we can actually make demands at a bargaining table, and we are making demands of the employers to provide for nurses who become infected. We're fighting for nurses to be tested. All right, we still have problems with nurses being able to be tested on a regular basis, or even tested when they have an exposure, and being able to quarantine for the full 14 days. So we're advocating that they're covered immediately for healthcare, full healthcare, if they have suffered an exposure or been infected, and that means mental health care and support and social services as well. And so that's something that is it's very important to us, and we will always fight for that.
And Bonnie, in closing, I wanted to ask you, while the pandemic continues to be challenging, what positives do you see coming out of this experience?
Well, I think it's illustrated what doesn't work. And I think it's paved the path for us to work with not, as nurses collectively, but also with all of our allies out there, which are our communities and our families and our patients and other social justice advocates. We've seen the vulnerable populations that have bore the burden. This is one of the reasons why that we speak out as social justice activists, right? We know that we have to confront these other social determinants of health to correct them. So we have the examples. We have the examples of what doesn't work, and we also have concrete examples of what does work. So I think we have clarity in this moment. We're still fighting tooth and nail because we have to. We're not out of this. We're still in the middle of this. And well, we know we're used to our patients and the public sort of having this cognitive dissonance, denial, sometimes people call, because it's hard. People want to go back to normal, right? We all do, but that's not going to happen unless we respect the science of infectious disease and we build a system that's actually going to provide the care that people need. It's really just that simple. And that's a good thing. So we're hopeful about that because it's not like we have to figure it out. It's not like we have to do studies or commissions. We know. And we know that we have a big role to play. As registered nurses, we'll be right in there. We want to care for everyone. And so that has been for us, we're hopeful about that.
I think that's a great message to end on. Bonnie, thank you so much for your perspective on the healthcare workers who have and will continue to guide us through this pandemic. Thank you so much.
Thank you. Thank you for the recognition. We're really thrilled about it. And it's further validation for all of us.